For a long period of time, many people are worried about the hardship being encountered in many health facilities, especially the tertiary ones, ranging from congestion at the registration unit, difficulty in paying medical bills at banks, as well as missing hard copies of patients' records, among other challenges.
Patients suffer a lot when they come to hospital in terms of getting registered to see doctors, making payment, and also going to the service area to access service. Usually they will stay a lot of time, some of them are very sick, some of them are very old. But there's a technology now that is going, that's been there for long. Only that it has not reached us, or we have not be part of it. But now we realize that it's important to follow the trends, whereby digitalization is the in thing now worldwide.
The Federal Ministry of Health and the Nigerian Communication Commission (NCC) selected the Abubakar Balewa University Teaching Hospital, Bauchi, along with 5 other health institutions across the 6 geopolitical zones to benefit from the Smart Clinic telemedicine suite.
This thing started just 2 years ago when we improved the optimization of these services. So by today now we have already reached our peak, whereby the patient now will access our service easily and can be accessed remotely also without coming to the hospital. It's going to reduce the waiting time for patients. It will improve the quality of care we are giving and to improve the patient, the doctor or patient, the health workers that will give the service within short time. So the congestion you are going to be seeing before, now is going to be less, and the patient will be happier than before.
I also commend Nigerian Communication Commission (NCC) for choosing to partner with ATBUTH in their e-health solution drive, which is a positive reinforcement. To be selected as a pilot site for patient mobile app through the NCC agenda of the prioritization of digital and mobile solutions is a laudable feat.
On the relevance of the platform towards improving healthcare service delivery, Dr. Abdul Hafiz is the lead implementer of the Smart Clinic across Nigeria and sheds more light on how the system works.
It's a mobile app and a kiosk self-service that allows patients to access the hospital directly. So in other words, the patients can now book appointments by themselves on their mobile phone, on their tablet, any device. They can also make payments from their own device. So instead of patients moving from one pay point to another, spending 2 hours trying to get their registration paid, they can now pay from their mobile phone. And once they make the payment, it automatically synchronizes with the hospital account system so that they can also have access in the lab. So if in pharmacy, the patient wants to buy Ampiclox, the doctor makes a prescription, they see it on their mobile phone. When they see it, they will see the option to pay. Once they pay, the patient will no longer have to go all the way to the pay point to go and pay. No, the patient pays on the mobile phone, the pharmacy receives the payment, confirms payment, and then can issue the drug. Same thing with X-ray.
Earlier speaking, Executive Vice Chairman and CEO of NCC, who was represented by the Commissioner from the Commission, says the Prime eHealth Hub is one of the recipients of NCC grant aimed at facilitating funding for the innovation startup ecosystem, adding that the grant was provided by the Commission to deploy Smart Clinic solution to facilitate appointments and payment to reduce queues in hospitals. Awal Hassan, Viewer TV News, Bauchi.